Good morning, everyone. Thank you so much for coming this morning. We are really, really happy that you are here, and the support is unbelievable. So my name is Anna Platz. I work for Lewis County Public Health, and I am also on the new Lewis County Community Crisis Response Team. This is my partner in crime, Crystal Collette. She is the hospice bereavement counselor and social worker. And we have some of our team members here today as well. Our team is consisted of all volunteers, so this is a really, really great day for them to recognize them and all the hard work they've done. Our team has been formed for about a year now. We've been actively planning and hoping for this day, preparing for this day, and it's finally here, so we're really, really excited. I've got some great support here today from Community Services and DSS, the Priorities Council in general, and they're going to help us give you a better understanding of the Lewis County Community Crisis Response Team and how it came to be. Pat?
All right, good morning, everyone. So in May of 2013, Sarah Bullock, who was then the Lewis County Director of Community Services, and Temperance Leindecker, who was the keyboard specialist, brought other community members together and began the journey to raise awareness about suicide within our community. Then, in a partnership with the Upstate Suicide Prevention Center and the Office of Mental Health, they utilized funds from the Garrett Lee Smith Suicide Prevention Grant and started the Suicide Lewis County Prevention Coalition. Over the past 5 years, the members of the coalition have worked hard to educate our community about suicide, available resources, with the idea of reducing stigma. Its most recent contribution is the creation of the Community Crisis Response Team, which is why we are gathered here this morning. The CCRT initiative has been led by Crystal Collette and Anna Platz with the support of the coalition and volunteers. The CCRT will give Lewis County another tool to support community members in time of need.
Thanks, Pat. So I'm Crystal Collette. A couple people have introduced me already, but nice to have you all here. This is an exciting day for us who are on the team, and Shannon and Becky are here, who are part of our team members and also part of our planning committee. About a year and a half ago, the Lewis County Suicide Prevention Coalition received a small grant from the Office of Mental Health, New York State Office of Mental Health, to put together a team of folks to respond to the family and loved ones after someone has completed suicide. And our group started off with a training. So we had a trainer from the Office of Mental Health come and work with about 30 people in our community for a two-day training to develop some skills around what we call post-vention. So intervening after a loss has occurred. We know that the risk for suicide increases after someone in our lives has completed suicide, and we even saw that nationally in the last few weeks. As we know, we had two high-profile folks who died by suicide, and personally, that really, to me, speaks to the need to take care of each other as a community after someone has lost their life. Our group quickly decided during our training process that because our community is so small, it's important for us to support folks who've experienced all types of sudden and traumatic losses. So the team made the determination that we wouldn't just be responding to deaths by suicide, but also intentional and unintentional drug overdose deaths, and when a community member dies in a car accident, ATV accident, or snowmobile accident, or in the event that there's a homicide in our community. So we're going to, although there's many other types of sudden and traumatic losses that we also experience, that's going to be our team's focus for now. We have about 8 active folks who've undergone even more training with the Office of Mental Health around responding to folks who are traumatically bereaved and responding to our community. As we know nationally that when someone dies by suicide, the statistic ranges from 7 to 30 people in their life are directly impacted, and those people need care. you know, large employers like Kraft or the county. When a death impacts our work communities, our coworkers need care and support. The hospital staff that might respond to that family and respond to that death need care and support. Parents need someone to talk to about how to talk with their child about, you know, their child's peer whose father died by drug overdose. We need to support each other during these times, and so the team will also be providing that community level support, providing opportunities for the community to come together, to talk, to grieve, and to make a plan for healing. Our team is diverse, and I think that that's one of the strengths of our team. We have folks from the faith community, folks from our schools, mental health professionals, and other folks who both personally and professionally have been touched by these issues. So many of us bring that personal and professional experience with loss. Our goal is to connect with individuals and families and link them to resources. So the team won't be involved in folks' lives for a long period of time. We'll connect, help folks get to the supports that they either naturally have in their life, like a really supportive aunt who just needs to be called, or get to a faith leader or a funeral home. I think that's my overview of the team, and we'd be happy to answer some questions in a few minutes, but I'd like to turn things over to Jennifer Jones, our Commissioner of our Department of Social Services, and Jenny's going to share a little bit with us about the importance of this work.
So Crystal called the other day and asked me to kind of talk about understanding the community need for a crisis response team. And I first said to her at first blush, I'm not sure I really have a story about that. And then I sat there for a few minutes and I really thought about several stories within my history at working at the Department of Social Services, being a community member within Lewis County, and then just really having one-on-one contact with families, that there's many, many times that a sudden and unforeseen death impacts people at work. We recently and are still currently in an opioid epidemic in Lewis County. And some children that I worked with years ago have passed away from an overdose. They were adults, well in their late 30s, early 40s now. So I'm thinking back to them. And what that felt like sitting at my desk when I heard about these children to me. What happened and what did we miss, and how do I manage around that? Much less their families, their moms and dads that we got them back to, their siblings, they're now their children. How do we help them at a community level deal and understand with us so that they don't move on to the next level and suicide as well? And then in the last couple days, reading about Anthony Bourdain and Kate Spade, I pulled up an article from the New York Times that talks about in 2016, there were more than twice as many suicides than homicides in the United States. And that hit me kind of really hard to understand that. At the Department of Social Services, we have a breadth of programs, but one of the ones that really gets in your face a lot is really Child Protective Services. And when my staff goes out and has to deal with a child that's been abused or has been killed by abuse, the ripple effect on the police, the district attorney, the ambulance squads, the child welfare staff, the staff back at the office, the court, it just continues and continues, much less the survivors, the neighbors that wonder what they missed and they didn't hear. So I was just so wonderfully happy to hear about the community responding. And in Lewis County, we always say that. It's our community that responds. It's not a few dollars from here or a few dollars from there. It is that our community gets together and tries to solve our problems here. So I think that this response team will continue to grow, have volunteers that come in and volunteers that leave, but it's really about connecting community to community and understanding what you can talk about, and it's okay to talk about it. So, thank you.
Thanks, Jen.
We'd love to take questions from anyone, from the media in the room, or from those of you who've joined us today. Yes, Nick?
So we've heard a lot about the team and what your goals are. Can you talk a little bit about how contact is facilitated? Will people be reaching out to you? Do you reach out to them? And what, does it have to be an immediate family member? What type of people is this service available to?
Absolutely. So we will not be reaching out to people. Our hope is that the more people we can educate about the team, the more people in their lives will know about the existence of the team, and when the time comes, whether it be immediate, whether it be a couple days after, they know that they have this resource available to them. So we've done a lot of education. We've talked to social workers in the emergency room. We've talked to the DA. We've talked to EMS, funeral home directors, so that the more people know about it, the easier, or hopefully the easier it will be for them to reach out. We are utilizing the hospital switchboard, so when a family or a friend, loved one would like to activate the team or request activation of the team, they'll actually call the hospital switchboard, and they have Crystal's my phone number, and we will then call our phone tree of amazing volunteers and decide if we're going to respond to this loss and how we will respond to the loss. We also have a website. We worked really hard on that. It's www.lewislivesmatter.com/ccrt, and that website basically has all the information we've shared with you today about how to contact the team, the types of losses we will be responding to, and contact information if there is a question that they didn't have answered on the website.
You have 8 members right now, right, that are trained for all of these different crisis responses. I guess, how do you know going into whether it's, a suicide or an accident or what it is, what to say to somebody right away, and is there one person that's better at one thing, or how does it work? How do you guys go and respond to something like that?
Mostly, I believe that what folks need after sudden traumatic loss is a listener. They need folks to sit with them and to listen to what's going on for them. Folks have all different reactions when someone they love has died suddenly and tragically. They might need help with, calling friends and family. They might need someone to accompany them to the funeral home. They might need to know how to talk to the kids in their lives about this death. We'll be following the folks that we work with's lead, and that's really the heart of our training, and connecting them with the support they already have in their lives is usually important. Our families and our community are incredibly strong and resilient, but sometimes when something really hard happens, we feel a little frozen, and that's normal, and we just need some support to get moving again, or time to not move and to just be, but to have caring people around us. I don't know if that answers your question.
It's kind of hard to answer that question because every loss is so unique and different, and really until we meet with the individual or the family, we won't know what type of response they need. So that's why we've been training basically all year long to be prepared for hopefully anything, but I think we're also going to learn a lot every time we respond to a loss, and that's okay too.
You said you've been training for this for a year now. Have you met with anybody yet, or is this sort of just happening now?
We haven't formally as a team met with any families or individuals, but several of us that work on the team together have provided outreach to families together in the past, so that our team has sort of come together naturally. And the school professionals that work on our team all have crisis response plans in their school communities that they utilize, and are bringing that wealth of knowledge to our community crisis response team. So I feel like especially our school professionals really bring a lot of strength to our team. We have 2 school social workers and a retired school professional who, guidance counselor, who brings a lot of knowledge and experience to our team.
And like you said, you guys are just there after the initial, incident. You're not there to be there the entire time with that person. Take them the service that you think they need. Right?
Yeah, we'll try to connect folks up with existing community resources, agencies in the community, and supports in the community that can help them as they move forward and process their loss.
As far as team members, are there I guess A, would you be looking for more team members, and B, would there be requirements? Do people on the team have background in counseling and things that you're going to be doing on a regular basis?
I don't have a background in counseling, but our team is kind of small in numbers, but strong in passion because they've received the most specific training, which for us was the debriefing training, being trained in that, which is very broad. But so at this point, I would say that until maybe down the line, we'll be able to offer another debriefing training, and that will be the opportunity if there's someone in the community who would love to join the team. They would have to undergo that debriefing training first. It's great that many of our team members do have the background in counseling, but for us, non-counseling professionals, that debriefing training was really key for us. So if someone would like to consider joining the team or hear more about it, they're welcome to reach out to Crystal or myself. And all that information is on the website.
I'll pick up a little on Amanda's question as far as you guys provide the immediate crisis response to a situation, and then obviously you're equipped with referrals and things like that to if they need a professional counselor or they need help in other areas, you'd be able to provide that type of
We help link them to that assistance, yes.
And one thing we know about any trauma is that the quicker folks get connected to resources and support, the better able they are to process that trauma. And so children and adults are incredibly resilient, and with help and support, we survive, heal from, and adopt into our lives incredibly traumatic things. And one of the ways to do that most effectively and in a healthy way is to connect with resources immediately. I think of how we provide, a sexual assault advocate in the emergency room when someone's experienced sexual assault. I think of this as similar. The quicker someone can connect with resources when they're traumatically bereaved, the better their outcomes will be. If they need that support. Some people might not, and that's okay too.
You guys go immediately after something happens, but what about prevention? Will you touch on that at all? You talked about how you have even people that work in schools that are on your team. Do you think they'll take sort of an education approach and talk to kids maybe about, what a drug overdose is, or what suicide is, and maybe try to do some prevention education as well?
Yeah, definitely. I think prevention education is a whole other piece of our work that we're doing both at the community level and in schools, like you mentioned. I also think that providing care to folks who are newly bereaved is prevention. And the ways we talk about national and local deaths by suicide or drug overdose really helps folks who are struggling know where and how to reach out for resources and to reduce the stigma around mental health support and recovery services. Any other questions? Do you all have any questions?
I would know from social services we're looking forward to be able to make referrals. We have a program at social services where unfortunately we sometimes have to assist families with burials for people, and quite often it's because it's an unplanned death, and my staff has really been looking for a resource to call to be able to say, here, I think these people will be able to help you, because people like to get busy immediately but then they don't know what to do next, and then they get paralyzed. So we're really looking forward to having this available for people who are struggling through a loss.
I don't know if we mentioned it, but did you want to give out the number for the team?
Sure. So to reach us after business hours, you call 315-376-5200 and ask for the Community Crisis Response Team. During business hours, you can reach us at Lewis County Public Health, and I'll let Anna share that number with you.
That one's 315-376-5453.
So we're really hoping all the professionals in the room and also community members make referrals to us. And over the next 6 months to a year, you'll probably just be hearing from us repetitively as we remind the community that we're up and running. Thank you all so much for coming and for supporting our work. We really appreciate it.